Hello? Yes, I will be at the airport at 7 a.m. tomorrow. Yes, I'm just finishing up the packages now. They'll be delivered later today. Yes. This will teach them.
Anthrax? Anthrax? Is this a joke? Anthrax! There's anthrax everywhere! My God, I gotta call Mary. Hello? Mary, can you please come over? I have newspaper with white crap all over it, and I think it's anthrax, but you're in nursing school. Can you come over right away? I need you right away. Please, come over. Ow! Just cut your hand on that screw. Sorry,
Yes.
Mary, but look at this. What is this? You should know what this is.
It's powder stuff. You're always thinking that something is more than it is. I don't know what's wrong with you. It's just somebody put flour in there or something.
You think?
I think so.
You're gonna get it on your hand. Be careful.
Ow, ow. Oh my gosh, it really burns. Maybe
Then it
it's
can't
not-
be flour. I'm contaminated and so are you. We should go to the ER. Let's go.
Okay, let's go.
Oh God! What are the symptoms? I've had a sore on my arm. I was cold last week. Headache.
Katie, it's CJ. You seen the news on the outbreak of anthrax? Can you come in? We need some more nurses here. Thanks. Don, it's CJ. Can you come in? We need some more nurses. Yeah, the anthrax outbreak. Thanks. Bye.
What's going on?
Alright guys, we got the anthrax outbreak. I'm sure you've heard of it. So I'm just going to give you guys a quick overview, and I'm going to send you right down to the ER so we can get this stuff taken care of, okay?
Okay.
Alright, so we can have three causes for anthrax. You have cutaneous, on the skin, inhalation, and GI. The GI is going to be from people eating contaminated meats, okay? Symptoms, what we're going to look for the cutaneous, we're going to look for itchy, painless sores with swelling, and if it's later in the stage, it's going to have a scab over, okay? Alright, so for inhalation, we're going to have like just a general infection. Fever, malaise, cough, shortness of breath. We're going to be looking for late stage, chest pain and shock. And then GI, you're going to have abdominal pain, bloody diarrhea, regular diarrhea, fever, mild sores, nausea and vomiting. Okay, I want you guys to keep an eye out for these. Tests, if you see these, we're going blood culture, a chest x-ray or a chest CT, a spinal tap, or a sputum culture. For the treatment, what we're going to do here for this outbreak, we're going to do Cipro, 500 milligrams POBID, okay? And we're also going to do Cipro 400 milligrams IV Q24. We already got doctor's orders covered for everyone who we need it for. And then prevention, someone comes in thinking they got it, but they don't show signs or symptoms, vaccine. All right?
Okay.
Let's
Got
go.
it. Do this. Dr. Swag,
Katie, what's up?
what kind of precautions are we doing here?
When dealing with an unknown bioterrorism attack, always remember to wear all the PPE. That includes your goggles, your mask, your gown, and your gloves.
Crap, Mary, oh my god.
Alright. Just hold on, they'll be out in a minute.
Oh my god. Alright, okay. Carla?
Yes.
Alright, I'm gonna take you in here. And who is this with you?
This is my friend. I called her because she's a nursing school. She knows everything, and I needed her help.
Oh my god, what is this on your hand?
Oh, you know, I cut it on her. What kind of bad stuff that was on your paper got in it? Now it's really bad.
Hey, Katie, we got a cutaneous over here. She's gonna need it.
Alrighty.
Sorry.
Can you please take off anything that might be contaminated? Let me grab some gloves.
I think I just got some on my sleeve.
Help me away.
I think
We're gonna
I'm so hot.
What should I do with this
Take this
then?
off of
put, you
me.
can give it to me, I'm gonna put it in the biohazard right here.
You really think it's got something?
Yeah, we don't wanna risk
Close the
it.
door if you want me to get
What do
naked.
you think it is?
We're gonna find that out, man. Let's take you in here.
It really is just a cutting.
No. Dr. Speck, we need more beds. We're filling up. People are coming in left and right here.
All right, hold
Who
on.
can we discharge?
Let me see. Let's get rid of 13A. They're the kidney stone. I'm running a script for Flomax.
Okay, 13A, discharge.
Let's get rid of 20B. It looks like their X-ray for their sprained ankle came back negative. We can get
20B.
them out. And then this person in 22B. Let's send them to outpatient. Their blood cultures came back negative, and so did their chest X-ray. So let's just send them to outpatient.
What do they have?
They think they've been exposed, so let's just send them to outpatient to get the vaccine. All right?
Okay,
All right.
done.
All right, Joe. We're going to send you to the outpatient, okay? Because
You're getting me out of here. I need to be admitted. I have anthrax. I just bought this newspaper. I gotta have anthrax.
The likelihood that you actually have the anthrax vaccine is very low. So what we're going to do is we're going to give you, send you to the outpatient, and then you can get the preventive vaccine there. Okay?
I'm not okay with this. Where's the doctor?
Swag.
He's okay to go home?
Yeah, he's good. You know, the X-ray came back negative. It's just a little sprain. Just keep some ice on it. Try to have him not move it too much. He's gonna have to miss the soccer game next week probably. But you know what? He's good. Just keep some ice on it. All right.
Great, thank
guys
you,
can go.
Dr. Swag. It was a pleasure meeting you. Are you single?
Get
Yeah.
someone in that room.
Okay, so I'm just going to run this antibiotic, Cipro. Okay, we're going to run it every 24 hours. Okay, so, and then since the anthrax is a bacteria, this will prevent it from multiplying.
They know it's anthrax?
Well, we're pretty sure, and we're going to treat it that way. So the blood culture came back positive, and so we're going to treat it for anthrax.
Do I need IV antibiotics?
We're going to be giving you a PO medication, so by your with the pill.
Thank you.
I'm finally gonna get some treatment around here. Yes, this is a
What about
prevent.
antibiotics?
Your blood culture and your chest X-ray came back negative,
Okay.
so you weren't exposed to anthrax yet.
Okay.
But I'm going to give you the preventative vaccine, so that because it's around, we don't want you to get it.
All right.
Okay,
About
so
time you get something.
alrighty, you just hold still, my friend.
It's gonna hurt.
Little pinch. Okay?
Okay.
Alright. Alright. Did you feel that?
Did you do it?
Yeah. Woo. I'm looking up staging on anthrax, and there's no particular stage. I think you just have it or you don't have it.
Yeah, it does say to call make sure that you have Cipro on hand, so we better call pharmacy. I'll do that right now.
Oh, is that our Cipro PO IV and our vaccines for the anthrax?
You got it, Dr. Swag.
Thank you. I appreciate it, pharmacy.
Thank you guys again for coming in and helping today. I wrote you guys some scripts so you can go get some prophylactic antibiotics.
All right.
You guys have a good day.
Thanks. Good. You too.
We're here tonight with Dr. Swag, Dr. Jonathan Swag of the Swag Department at Swag Hospital in Illinois. We're going to talk to him about the recent anthrax outbreak. Dr. Swag, what is the role of healthcare providers during an attack?
Thank you for having me, Amy. To answer your question, we report confirmed or suspected cases of anthrax to the local health department. We don't wait for lab confirmation because we need to anticipate the need for collaboration with the health department on confirmation of the clinical diagnosis, laboratory confirmation, and investigation of the source of the infection.
That's interesting, Dr. Swag. Now, what does the lab need to do?
So what the lab needs to do is to report confirmed or suspected cases to the local health department. They need to fax lab reports to the health department, and they need to consult with the Office of the Laboratory Services regarding any requests for testing or confirmation of anthrax in a clinical or environmental sample.
Very interesting stuff here. Dr. Swag, let's say somebody walks in off the street and they say they've been exposed to anthrax. What does your facility do?
So right after exposure, the patients would need to remove all their clothing and place it in a labeled plastic bag and shower thoroughly with soap and water. The clothing becomes evidence for the FBI, but most people don't know they're exposed until symptoms start, unless they have a letter received a letter telling them that they were exposed to the anthrax.
Interesting, interesting. Now, how do you decontaminate the surfaces of the hospital in order to protect the other patients that are using the facility?
So we use an environmental protection agency approved sporicidal/germicidal agent composed of 0.5% hypochlorite solution and 1 part household bleach to 9 parts of water.
Groundbreaking stuff here. Now, Dr. Swag, according to your Bioterrorism board, what should a victim do during a hoax scenario?
So if a patient gets a letter containing powder and it clearly states that the patient was exposed to anthrax, they shouldn't panic. It's the first thing they shouldn't do. They should leave, call 911, and the FBI will be called in to investigate. A task force will ensure that the appropriate safety measures are taken.
Yes. Good. Now, what should a victim do in a massive attack scenario?
So in this scenario, people will generally be collapsing in the street. The FBI and CDC will soon present themselves to manage the situation. Healthcare workers will provide empiric and supportive treatment, and some healthcare workers may be infected themselves.
Interesting. Very interesting. Did anyone catch that at home? I hope so. Now, Dr. Swag, what are the major facility needs regarding hospital care for those with anthrax?
So, very quickly, we need to perform chest x-rays, blood cultures, and provide antibiotics. All these will need to be on hand and available in order for us to control the outbreak of anthrax.
Interesting. Very, yes. Now, doctor, what are you doing to protect your staff and yourself from anthrax?
So we're following recommendations from the Illinois Department of Public Health, and we are using standard personal protective equipment, which consists of a gown, mask, goggles, and gloves.
Jolly good. Now, do you feel your facility has enough equipment to keep you safe?
Yes, I do. We are fully stocked with PPE and also have powered air purifying respirators on hand as precautions for possible airborne or powdered spores.
That's excellent. That's wonderful to hear. Now, what are powered air purifying respirators?
We actually have one on hand for me to show you. So there's a motor blower that draws contaminated air through a high efficiency particle filter, and blows filtered air up into this head covering, and this helps reduce respiratory exposure to airborne particles. And if you wanted to see all the different parts of it, I have this nifty little
Very cool. That's a very interesting mask you showed me there. Now, Dr. Swag, at what point would you use the powered air purifying respirators when dealing with anthrax?
So, if a patient came in with obvious powdered spores on them, we would wear PPE and the PAPR and take them to our decontamination room. Our decontamination room is just outside of our emergency room. Then we would decontaminate them. We would remove all their clothing and place them in biohazard bags and shower the patient with soap and water while we are still wearing the PPE and the PAPR.
Yes, of course. Now, Dr. Swag, what population is most susceptible to this anthrax?
So there are three populations that are most susceptible. The first one is healthcare workers. We're the first line of defense if an outbreak happens. Therefore, we're at the biggest risk of catching anthrax. The other two populations are travelers who travel outside the country. They need to consult with their physician if the country they've been to has had a recent anthrax outbreak or is commonly known to have anthrax. And the other population is people who play animal-skinned drums. And the best way to make sure that you're not playing an animal-skinned drum contaminated with anthrax is to make sure it's from the United States or it has gone through the proper inspections.
Final question, Doctor. Final question. What is the mortality prediction of an anthrax outbreak?
So the mortality prediction is with inhalation, it's 80%, but that's only if you don't get treated for it. Otherwise, it's down to about 20%. And then the cutaneous version is down to about 20% by itself without treatment.
Very good to know, Doctor. Very good to know. Thank you for all the time you have given us today. This is Amy reporting off for Swag Nation.
It was a pleasure being here. Thank you.
What part does the local health department play in an anthrax outbreak? Prior to the occurrence, they protect employee health and educate employees about the transmission of the disease. They train and assemble outbreak response teams and educate healthcare providers and the public to recognize or diagnose anthrax. They educate providers and labs on reporting anthrax to the local county of the patients immediately. Then, after the suspected outbreak, the local health department contacts the Division of Infectious Disease Epidemiology and not wait for lab confirmation. The local health department should be ready to collaborate with the Division of Infectious Disease Epidemiology and other federal, state, and local public officials and law enforcement to confirm cases, do incident triage, and investigation of the outbreak. So then, what is the Division of Infectious Disease Epidemiology responsible for? Before the outbreak, they train their staff in occupational health issues and surround an anthrax case investigation. They maintain an adequate staff that can respond rapidly to consultation, outbreak investigation, and field investigation. If there's a suspected or confirmed outbreak, they notify the CDC. During the outbreak, their job is to support the local health department, brief the chain of command, and make recommendations for initiating incident command and offering vaccines and prophylactic treatment to targeted populations. Also, they make decisions for the appropriate message for the public and healthcare providers.
Does that make sense?